Hi, I'm Dr. Choi-Kain. Some people call me Dr. LCK for short. I'm really glad to meet you because it's important that we discuss things you need to know to navigate your care of borderline personality disorder. I think when people are diagnosed with borderline personality disorder, they simply need to know the things that all patients need to know about their disorder. So we'll review 10 topics over the next 2 weeks. What we'll start with is a discussion of the symptoms of borderline personality disorder. What are the symptoms that you know you have? We'll go over all the symptoms, even the ones that you may not actually have yourself. Then we'll move on to what we feel is the engine of borderline personality disorder, interpersonal hypersensitivity. So we feel that when you're sensitive to what happens in relationships, that will cause your symptoms to fluctuate. And by knowing that, you'll have better control over how you feel. Then we'll move on to some basic facts that it's helpful to know about borderline personality disorder, like how common it is, because then you'll know that you're not alone. We'll also talk about what causes borderline personality disorder. In addition, we'll go on to talking about the longer-term course of those who have borderline personality disorder. So you'll know that it does get better. You'll also learn from that discussion that you'll need to work on your functioning. In the last part of the first week, we'll talk about other disorders that people with borderline personality disorder commonly have. So what I'll talk to you about is how these other disorders relate to borderline personality disorder. This will enable you to know when to prioritize your treatment of borderline personality disorder and when you need to prioritize the treatment of other disorders you may also have. Moving on to the second week, we'll start to talk about treatments. First of all, there are some things that you'll need to know just to organize your attitude towards your clinical care. There are some key principles to approaching treatment that I'll share with you. Then I'll go on to talk about common features of the treatments that have been developed for borderline personality disorder that we know work. Next, we'll talk about medications. Most people with BPD are on some medications, whether they're for other psychiatric disorders or to manage the symptoms of borderline personality disorder. We know that no research consistently shows that these medications work to decrease the symptoms of BPD. Next, we'll talk about the psychotherapies that are really considered the gold standard for treatment of borderline personality disorder. While these treatments may be hard to access, I'll share with you the key ideas from these treatments so that you'll know them regardless of what care you pursue. Lastly, we'll review all that we've learned in the last 2 weeks so they'll be clearer and more organized in your mind as you take these next steps forward. I'm really glad you're here, and I hope you find this useful so that you're clearer in your thinking to make good decisions and feel less alone. I'll see you tomorrow.